Okay, in this video, I'm going to discuss how you can enter health information or history related details into a patient profile. So I'm going to dummy patient list using this shortcut all button. These are the all patients recorded, registered in our organization. So I'm going to this patient here. So now this is the patient profile. I have done a different video around this. You can look into that to get more details. Um, and here we have uh, past medical history details, alerts, medication, family history, social history, and so on. And we have special other information section as well, which has even additional registration information, which we captured information here in the demographic, other additional entries details like this. So you can go into that and have a good look. Anyway, I'm going to discuss around how these can be saved, these health related information, and how these can be edited, and how notes around this can be set. So I'm going into patient the health information entry form through using this button. If you have selected one item here, and if you just click this button, that would take you to the relevant page which has information around that. And if you want to enter new one, you have to press this button. But before that, I'll show you how you can keep information of one item, like the note format. So let's say now this note here says had HP 92 and no problems. And I'm going to put another note here saying infusion done in January 2025, something like that. So that's a new note. So you can simply add notes like this. And in the future, this will be connected to correspondence as well regarding the one history item. So coming from the other healthcare providers, that would be like a collated information section, which you can learn around, study around that particular disease or condition. Anyway, now let's see how you can enter new history item or history information into this section. Now you want to say, let's say you're going to add chronic renal failure here. So I'll put it as a comorbidities. You can put it to one of these sections. Comorbidities, past medical history or past surgical history. I'm going to put it into comorbidities. So I'll put chronic renal here, and then if you take the cursor out, because there are resources to terminate the resources we are getting information from. Let's say complaint, if it's under complaint, or else you can select diagnosis, one of those, these two repositories. We should filter out some and suggest some terminology for us. So you're gonna select chronic renal failure. So you can play around with this. So complaint and diagnosis are two separate terminology sections. Um, Now let's say if you add a new item which is not there in either of these repositories, that would be automatically added into that system, that database. So that would be available once you are coming back and enter the same item. So now I'm gonna save this. Now this is saved, chronic renal failure. I'm going to put a date, detected date or effective date around that chronic renal failure. You can directly put a date like this, or else you can give, let's say, occurred this number of years back. Let's say I'm saying this is occurred 10 years back, so then that would calculate 10 years from now and give us close date. Or else you can select in which age this has occurred. So let's say this is diagnosed in 61, something like this. Then that gives sort of a uh, date calculated from the date of birth. So then I've saved that date. Then you can put a description there. Type stage, let's say stage two renal failure, something like that. So sort of this is sort of example. So then actions. So you can see there are some actions coming from the population. So on medication, something like this. So likewise, you can complete this. Um, so now this is past medical history. So on you can put alerts, allergies, family history, social history, medication related information, which has a lot of components like brand name, strength, uh, likewise. So we'll do a different video around medication, and then we have a vaccination, and other sections will be added as well. Let's say the development history, dietary history, so on. That would be added very soon into this section. Now here, there's another section which you can see what are the comments coming from the patient side. I'll get another patient, a different patient, to show how this works, because patient can use their mobile app to communicate with you, and then they can validate information that you have in this section. Let's say if I go into this one, now consumer says. Um, consumer comments, medical diabetes seen by Dr. Faisal now. So because looks like you got something wrong in this information, let's say diabetes. So you say admitted hospital, Dr. Faisal's scan. So then that's so the patient is confirming, and here patient says past surgical comments. It's like a test entry. So likewise, patient can comment and consumer entered data you can see, but patient has entered in their past medical history details. So using this one, of course, you can directly, let's say now hernia repair. If it is not here, it's there. But let's say lump removal, is it here? Lump removal is not here. So let's say if I want to get lump removal, which has been put by the patient from their side, so I want to put this one into um, copy into our section. So let's say copy to care provider. So do you want to copy the selected value that the care provider record? Yes. So record saved. So now this lump removal has been added into our section according to the patient's details. So it looks like once patient is entered data from their consumer app, easily you can copy that information into your section as well, which should give more accuracy to the health information that you are managing here. Um, the other thing, you can simply delete items. Let's say I put an item to delete. Let's say I'm going to put past medical history, uh, uh, something like DVT, save. But let's say if this is wrong, I want to take this one out. I'll press delete button. Yes, it's gone. Let's say you want to edit sort of information that you have already entered. So I'm going into past. Let's say I'm going into lump removal section. I'm going to edit. Uh, I'm going to, let's say you can edit the item name, lump removal, lipoma, dermoid cyst, something like this. Now I can edit the name of the main entry. Let's see if I need to edit one of these. Let's see if I want to edit this, click this button. You're coming here. something like that. That's done. So it's saved automatically. You don't need to really worry about that. So once you get out of that particular pop-up, it's completely saved. So this is how you can manage your past medical history, alerts, allergies, health information. And if you want to go back to a patient profile here, simply you can click that button. You can go there. Let's say if you are in a sort of episode, like let's say I'll go into episode, how to create episodes and more details around this. But I'm just going to demonstrate how you can navigate into this section. Let's say if you are in a hospital, clinic, or outpatient or GP visit kind of um, sorry, episode. So now let's say this is a patient. You are in a outpatient episode. Let's go in one of these. Yes. Let's now here we can see you can enter your information here like that. But let's say if you want to go into the patient demographic information, sorry, the patient past medical history details, what you can do, you can go in here, you can go into background, and you can either go like this using these buttons. Then let's say you are exploring around this, editing this, and you want to go back. Just now you can see this button has appeared. If you click this button, you are going back to the place that you came from, which is really easy for navigation. Let's say if you want to just take a look and just copy the list of problems that you had in the patient background. So I'm going into background, this one. Then you can see this gives sort of a summary, and you can copy the list here like this. It says you have to select all like this. I'm selecting all these C or Control C like this, copy and exit, and I'm coming back here and putting like this, Control V. Then you can see the background is copied, right? You can save like this. Then that's saved into your outpatient record. So something like this. This is really easy to navigate and enter your health information. All right, so that's it. So of the patient health information registry. So I'll talk more around how to create episodes and how to navigate into episode activities and how to put notes in these episodes in coming modules. Thank you.